Medical experts say artificial intelligence is transforming the practice of medicine. They say AI is helping doctors diagnose patients more accurately, contribute to improving communication between physician and patient, and transcribing medical documents such as prescriptions, and remotely treating patients as well. A digital health startup, Hurone AI, is building culturally sensitive AI-powered applications targeted to people of African descent. Hurone AI aims to bridge the gap of cancer care outcomes in underserved regions by using data and algorithms to help cancer patients manage their care, increase access to oncologists, and navigate complex healthcare systems for better treatment compliance. I spoke with Dr. Kingsley Ndoh, founder and chief strategist for Hurone AI, about the transformation ongoing in medicine with artificial intelligence. Take a look.
This project is very personal to me. My favorite aunt died from advanced stage colorectal cancer. A year prior to that, she was complaining of just abdominal symptoms, and she was being treated in one of the best hospitals in Nigeria, and they were treating her for reflux disease. And then when I began to reflect on this and look at the data, I realized that my aunt was not an isolated case. That sort of motivated me, and that inspired me to want to do something about it.
Why the choice of artificial intelligence? You are a medical doctor. Why did you make that jump, and what does the project itself consist of?
There is a need to use data from people of African descent to drive some of these technological processes that are already happening in other parts of the world. We have a physician-facing side where doctors, can see the basic data of their patients, the demographic and clinical data, and they can monitor their patients based on patient-reported outcomes. On the other hand, patients have their smartphones or just their mobile phones. They can use a USSD system, which is a text-based system. When the patient is on a treatment regimen, they get questions that is specific to the kind of side effects that are anticipated based on the data that the doctors already have. And then they can score these side effects. They can also get like open-ended questions like, how are you doing? And they can input that data. And every time when the physician comes to a hospital and opens their system to check how their patients are doing, and they can know what to address in a timely fashion. We found that 70% of the complaints that patients has can basically be addressed through text. When there's an emergency, the suggestion is sent to them to go to the nearest hospital. And with the data that we are building from the beta trials that we're currently conducting in Rwanda, we're going to be building machine learning models that can help predict best treatments for patients.
If they are not health literate, they don't have a cell phone, for example, how is this solution going to work for them?
They can have their $50 mobile phones and they can still access the services. The other feature that we've included is to include major local languages. And when patients are entering data, it's very simple. They don't have to be super educated. A lot of the side effects scoring system is just a yes or no, or mild, moderate, severe.
Will there be a need to adapt the solution in each country depending on the local needs?
The problems are quite similar. Obviously, we're going to adapt and tweak things depending on the country, but that shouldn't take a whole lot of time. We want to ensure that we have the right data to support the processes throughout the cancer control continuum.
A lot of times we don't hear about therapeutic side effects and medications and vaccines. Why was it important for you to focus on that as well?
Of all the oncology medications that were approved by the FDA in the past 20 years, less than 3% of people who participated in that clinical trial were people of African descent. Furthermore, a group in University of Virginia did a study, and they were trying to find out why, African-American women weren't responding well to a certain breast cancer drug. And what they found is that those African-American women, they had a higher frequency of certain side effects compared to Caucasians. we've not been able to really reach the kind of data diversity we want to have. One of the major ways to know this is just to see what's happening from a place where it's just over 90% Blacks. When we talk to people on the ground, that was a big pain point. Patients felt disconnected. They felt that they don't have anyone to help them. That's why we focused at this early stage on just that data, so that we can have like a full spectrum and we can have better patient compliance and completions for their therapies, and obviously better outcomes.
And that was Dr. Kingsley Ndoh, founder of Hurone AI. And that's our show for today, our health report for today, rather. Esther, back to you.